I'm Dr. Bhavesh. I'm a medical oncologist at Thangam Cancer Center and Thangam Hospital, Namakkal, Tamil Nadu. Today I'll briefly speak about lung cancer and what are the treatment modality which are happening very recently in this lung cancer. So lung cancer has been a very difficult cancer to treat. The most important reason is because it is diagnosed in a very delayed stage. Globally, almost 70% of the patients are diagnosed in a late stage, and hence curative treatment is not possible. I think in India it is much more higher, maybe 80 or 90%. But because of the recent awareness, the lung cancer is being detected early and we are able to give them a curative option of treatment. So the most important treatment which remains for lung cancer is surgery. But as the tumor starts becoming bigger, usually more than 3 to 4 centimeter, we do not require only surgery, but we also require some other kind of therapy which is called as chemotherapy. Now the latest advances which are happening to improve the overall survival, or we can say in simple terms the life of patient, what changes have happened, that is what I will be speaking about. So the chemotherapy which has been given after surgery, now they are trying to give this therapy before the surgery, and not only chemotherapy but also they are adding immunotherapy. Immunotherapy is one of the newest modality in lung cancer and it has helped a lot of patients to cure this cancer. So how does it work? So it works with chemotherapy in sync. So chemotherapy plus immunotherapy is being given for around 2 to 3 months before surgery, and the most important goal of giving this therapy before surgery is to shrink the tumor as much as possible and makes the surgery easier. There are almost 1/4 to 1/3 of the patients, means almost 25 to 33% of the patient will have a complete response. That means the tumor will completely regress and it is possible that the surgery will be giving a better outcome for these patients. So we are expecting that this immunotherapy is going to make a major difference, and it is going to increase the life of the patient and also possibility of cure in many patients. So with the surgery, we know that when chemotherapy is given or immunotherapy is given, there are certain side effects, but always remember these side effects are temporary. Many of the time, even the commonest of the side effect, what we see, hair fall, that also usually doesn't happen with some chemotherapy which are given for lung cancer. Of course, there are some small problems which are there. It can cause inflammation, it can cause diarrhea, it can cause some skin changes, sometimes some breathing difficulty, some lung problems. So these are something which can happen, but it is not that it will always happen, and whenever it happens, your medical oncologist will take care of it and will treat that also with the lung cancer. So something what I want you to be aware of is Lung Connect. So Lung Connect is a platform which helps patients as well as relatives to come on the same platform and share their problems, get their solutions for their problems, and it is the ever growing society which is helping each and every individual who are coming for help. There are so much different problems, social problems, emotional problem, financial problem. Many a times the awareness is not there what to do, what should be the next step. So Lung Connect will come to your help and it will give you more reasons to be attached to them.